I'm just doing the voice part. So.
Okay.
All right, thank you.
So last time we spoke, I wanted to get another scan to relook at everything to make sure that nothing looks like it progressed, or we didn't see any tumor that looked like it was outside of the pancreas, and to see if the vessels and everything looked clear, to see if she was a candidate for surgery first versus chemotherapy first.
Right.
And he looked at it and he thought it wasn't an indication to have chemo first.
Right.
So I looked at the scans now, and it doesn't look like there's any reason we can't remove it.
Okay.
That being said, about 1 in 5 cases, everything looks good on the scans, but when we actually get in there, there's tumors that's too small
That you won't see on the
to
scan.
see, right, or it's invading a vessel that we can't remove and things like
Gotcha.
that. There is a little bit of the stent and everything goes right past where one of the big veins are, and so there may be some involvement there. It's hard to tell. Sometimes that vein is one that we can remove part of it and reconstruct it.
Okay.
So that would be sort of the plan going in. So
I have a couple of questions.
sure, absolutely.
I'm a little concerned because of her age factor. She's 77 years old, and I've been doing some research. I wanted to know if there is any other option. The surgery seems to be pretty aggressive, isn't it? There's like 5 organs that are being affected altogether.
Yeah.
There's concern that she might not make it out of the anesthesia, as you're older and stuff like that. How do you feel about that?
So any studies they've done even on this procedure show that it's more about your physiologic age. In other words, I've had patients that were 46 years old, but had a lifetime of smoking, drinking, heart
Gotcha.
disease, and they couldn't tolerate the procedure. But you have an 83-year-old that does fine.
Okay.
So I look more at what the actual parameters are, like what does her heart look like? Can she exercise? Does she have history of those things in the
Right.
past? And if you don't, then the age doesn't really matter as much.
There's also, I was doing some research. There was a doctor in California that the same surgery, he's done like a revision where he only does the pancreas only. Is that an option in this case, or do you know of any doctor in town that might, or?
The
I'm just
problem
looking
with
for
that-
the whole picture.
No, I get
That's what
it.
I'm looking at.
The problem with that is if you're doing this procedure for pancreatic cancer, you need to take out all those other organs to make sure the tumor hasn't spread to them.
Correct.
Make sure you get all the lymph nodes in the area.
Okay.
So there are descriptions of that procedure, just taking out the pancreas without everything else around it, but only for benign disease, not for cancer.
Gotcha. If we decided, let's say, not to do the surgery and just do the chemo, what would the forecast, or what would that be like,
So for pancreatic cancer, let's say you don't do anything, let's talk about the whole spectrum.
Right.
Let's say you don't do anything, then the lifespan is, on average, if you take 100 people and you do this, it would be about 3 to 6 months.
Okay.
If you just did chemo, you would get an additional 2 to 4 months.
Okay.
If you do just surgery, then you're talking 20 to 24 months.
Okay.
And so the best case scenario would be surgery plus chemo, and that gives you somewhere between 24 to
So it's a life expansion
30.
of, yeah.
Yeah.
After surgery, what is the expected quality of life for her? She's gonna be in bed all the time.
No, I mean, so the part that we can't predict is how someone's going to recover from the surgery.
Right.
Some people, my average is about 5 to 7 days in the hospital when people go home.
Okay.
Some folks are more debilitated, and it takes them a while to get strong again, and so they have to spend some time in a rehab facility, things like that.
Okay. So.
What else? A lot of that is predicted by how strong you are and how functional you are before.
Okay.
Because it takes a lot of energy to heal from this, and about 6 weeks of time to kind of be back
Okay.
close to normal.
Okay. That's good. So she is a candidate for surgery at this point, right?
I think so, yeah.
Okay. We could just proceed then and go from there. Yeah.
Does she have any questions?
¿Tú tienes alguna pregunta? Él está hablando de la cirugía.
Sí, yo lo oigo, pero no lo entiendo un poquito.
Él dice que la mejor opción que tenemos en este momento sería la cirugía. La cirugía es un poquito agresiva, yo te voy a explicar sobre eso en casa. Y hacer un poco de quimioterapia, hacer la cirugía y entonces a ver cómo vamos de ahí, expandir la calidad de vida, el tiempo de vida. Porque estamos hablando de cáncer, que es una enfermedad terminal, pero todavía hay opciones que se pueden utilizar, tú sabes, y todo lo demás se lo dejamos a Dios, porque todo se le deja a Dios. Entonces, if she does, how much sessions in chemo? Is it radiation, chemo, pills? How does that work?
So whether we add radiation or not depends on the pathology. So if there's lymph nodes involved, or if there's microscopic tumor that we couldn't get out, then we may add radiation. Chemotherapy there's different regimens, so it's hard for me to say exactly, but typically is somewhere around 6 months, sometimes 9 months. And the reason is sometimes if you don't tolerate the initial doses, sometimes they'll reduce the dose and give it to you for a little bit longer so that you get the same total dose.
Okay.
But it's typically just chemotherapy. One of the typical regimens, you would come in, they would put a pack on that's hooked to a port, and that infuses constantly for 72 hours. And you come back and get that taken off.
Okay.
At the time you get that placed, there's a 4-hour infusion you get for 2 drugs, and they would also give things like steroids and anti-nausea medication to try to prevent some of the side effects.
Okay.
And then, and so you do that. So like Monday, come back Wednesday to get the pack taken off. Do that again the next week, and then sort of have a week off.
Yeah, that I'm familiar with my grandmother.
Mm.
So if we start, let's say, how soon will we start the chemo? Like ASAP or?
No, you have to heal up from the surgery first. So it's usually.
So we're doing the surgery first and then the
Yeah.
chemo. Gotcha. Okay.
And so it would typically be about a month or so after.
Okay.
The key is to start it within 4 months of surgery.
Okay. And how soon can we start the surgery?
So what we'll do is now that I've talked to her and she's have any other questions, I'll have my scheduler come and give you a date so we'll know
Okay.
exactly when.
Perfect. Thank you very much. I appreciate it. Mami, ¿tienes alguna pregunta para el doctor?
No.
Él está hablando de hacer una cirugía primero
Ajá,
y
dime.
después que la cirugía, entonces que ya te sientas mejor de la cirugía, entonces te van a dar quimioterapia después. So, va a ser un proceso un poquito largo y va a ser un proceso donde vas a estar bastante tiempo en cama también. Nosotros te vamos a ayudar en todo, tú sabes, pero eso es lo que estamos mirando en este momento.
Yo hago lo que tú digas.
Ok. ¿Te sientes cómoda sobre todo? Tú tienes mucha fe en Dios, ¿verdad? She
Sí.
said whatever I decide, but no, I'm like...
Yeah. So in terms of the surgery itself, you've read some of the steps, but essentially we remove part of the stomach, the first part of the small intestine, the head of the pancreas, the gallbladder, and the part of the bile duct.
Right.
We take the small intestine and then we reconstruct those areas so that your GI tract is reestablished so you can digest food again.
Okay.
And so to do that, we reconnect the small intestine to the pancreas, to the bile duct, and also to the stomach.
Okay.
So whenever we do surgery, there's a risk of infection whenever we make an incision. So we give
course.
antibiotics ahead of time to minimize that risk.
Okay.
There's a risk of bleeding,
Right.
which typically happens during the surgery, and we control
Right.
that there. There's a risk of leak. Wherever we sew things back together, those can break down for a number of different reasons.
Okay.
And it's a low chance of it breaking down at the stomach or the bile duct, but about a 15% chance of having a leak at where we sew the pancreas back to the small intestine.
Okay.
We leave a drain in, and we also have a tube in her nose going down to the stomach to decompress it. Those typically stay for 3 or 4 days.
Okay.
If there is a leak, then most of the time you just have to leave the drain that's coming out of her side longer until
Okay.
the leak resolves itself. In some cases, the leak will be worse and we'll have to add antibiotics, put a separate drain in. In rare cases, we'd have to reoperate for that.
Okay.
Sometimes the leak will try to kind of come out itself, and it can come through where the incision is, causing a fistula, and that can take some time to heal, but that's not a very common
Okay.
thing.
These things that will they monitor while she's in the hospital, or this is something that can happen when she's at home, and we got to keep an eye on.
It's typically things that we'll monitor for before she leaves.
Gotcha.
So
Okay.
some people will have a leak that we know about going home, and we say, okay, leave the drain, I'll see you in a week, check on things, and that's
Okay.
kind of how that goes.
That's good. ¿Está todo bien, mami?
¿Y qué tiempo entonces va a pasar eso?
She wants to know how
What's gonna
soon. Yeah.
Yeah. Okay, I'll find out for her right now, okay?
Okay.
All right.
All right. Thank you very much, sir. I appreciate your
Thank you.
time.
Hey, it's good to meet you.
Hey, yeah. Same here.
Thank you. God bless.